Now, despite this drop, there still has been a significant case increase in Knox County over the past week. Today, the Knox County Health Department spoke about what this means for the county during its briefing.
Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see if things are staying the same or are they getting worse, and if so, how much worse. This week, we again experienced a 3-day statistically significant increase in new cases. These increases caused us to keep this traffic light as red. While we have expected an increase in our cases as our community continues to reopen, this increase in new cases is concerning. We want to stress to our community that this virus is still very present in Knox County, and we continue to stress the importance of the 5 core actions. There could be several reasons behind the increase in new cases, and we continue to investigate. There is more opportunity for testing, more people are out and about as our community continues to reopen, and we've identified several clusters. To put this increase in perspective, before the community reopened, each case only had about 3 close contacts. That's because they weren't really going anywhere for the most part. The cases were staying home and maybe running only a few essential errands. Now, as the community reopens, cases may have 3 to 15 or even more close contacts. Our team is responsible for reaching out to every close contact and providing daily check-ins to determine if they develop symptoms. Just last weekend, our team was checking in daily on more than 700 close contacts to cases. We have seen an increase in cases in the 11 to 20-year-old demographic in general. I think we've had an increase in 15 cases in that group this week alone since Monday, and that's concerning. And so what we say is, again, this virus is out there and it's present, and we really want people to follow the guidelines. When you're in social groups, it's really hard to stay 6 feet apart, but we need you to do that. We need you to be wearing masks and washing your hands frequently and doing all of those things that we're asking, and limiting the social interactions that you have when you don't have to go out and about. If you've attended protests and you're concerned about potential exposures, we encourage that you get tested. And if you're attending ones in the future, that you try to do your best to follow the guidelines there as well. So at this point, we're looking at data and looking at the benchmarks for this week. And as we said, there'll be more information next week on the phase 3 portion of the plan. But our benchmarks right now, a lot of them are doing well. The new cases we're concerned about, but we hope that they level off and stay at a manageable level. And we'll have those discussions into next week.